Hi. I'm robo-Suzie and today I'll talk to you about what is varicose veins and what is the treatment for this. Also don't forget to check out the link below, to find out how I got rid of varicose veins fast and easy. I didn't believe it at first. But back to our topic. Veins are blood vessels that return deoxygenated blood from the outer parts of the body back to the heart and lungs. When veins become abnormally thick, full of twists and turns, or enlarged, they are called varicose veins. Varicose veins are a very common condition. The word varicose is derived from the Latin root word varix, which is translated in English as twisted. Varicose veins are swollen and enlarged veins which usually appear blue or dark purple in color. They may also be lumpy, bulging, or twisted in appearance. Varicose veins are a very common condition. Women tend to be more affected than men, with approximately 30% of women developing varicose veins in their lifetime, compared to 15% of men. Symptoms of varicose veins can include aching, heavy and uncomfortable legs, burning or throbbing in your legs, muscle cramp in your legs, particularly at night, and dry, itchy and thin skin over the vein. Causes of varicose veins: sluggish circulation due to smoking, lack of exercise, my use of diuretics, constipation, standing for a long period, wearing tight clothes, obesity, emotional upsets, suppressed anger. Treatment today usually doesn't mean a hospital stay or time-consuming, uncomfortable recovery. Less invasive techniques are available that can be done fairly quickly. Treatment of varicose veins. Treatment today usually doesn't mean a hospital stay or time-consuming, uncomfortable recovery. Less invasive techniques are available that can be done fairly quickly. Below are some procedures that your physician may recommend. 1. Sclerotherapy. Sclerotherapy is a medical procedure used to treat varicose veins and spider veins. A medicine is injected into the vessels, which makes them shrink. It is suitable for most children and young adults with vascular or lymphatic malformations. In adults, sclerotherapy is often used to treat varicose veins. Sclerotherapy is done in office or small place using small needles. The procedure does not take more than 30 to 60 minutes. After several sclerotherapy treatments, most patients can expect an 50 to 90% improvement. 2. Laser endovenous therapy, EVLT. EVLT registered as the first choice of physicians and patients when it comes to a minimally invasive alternative to painful surgery. The EVLT registered procedure is a simple and effective. With a success rate of up to 98% and minimal side effects, EVLT registered is the new gold standard in varicose vein treatment. The procedure takes about 45 minutes with local anesthetic and is done on an outpatient procedure basis. There is no risks from laser treatment, but afterwards sometime you feel tightness in your legs. 3. Trance Illuminated Powered Phlebectomy, TRIVEX. Trance Illuminated Powered Phlebectomy is a minimally invasive technique to directly remove varicose veins. Trance Illuminated Powered Phlebectomy is intended as an alternative to traditional phlebectomy for symptomatic varicosities of the leg and as an adjuvant to surgical removal of the saphenous vein. Trance Illuminated Powered Phlebectomy is performed under general, regional or local anesthesia. This procedure offers good cosmetic results. The procedure can be performed in about 30 minutes. Normal activity is encouraged immediately and most patients return to work in 2-3 days. 4. Ambulatory Phlebectomy. This procedure allows for the removal of large surface veins and may be performed in conjunction with endovenous laser ablation or other therapies for varicose veins. It is done in the office under local anesthesia. This procedure involves making tiny punctures or incisions through which the varicose veins are removed. The incisions are so small no stitches are required. Patients can go back to work and normal activity after 24 hours. 5. Vein stripping. Vein stripping involves tying off of the upper end of a problem vein and then removing the vein. Vein stripping is performed in an operating room. Modern alternatives to vein stripping include endovenous laser treatment, radiofrequency occlusion and ultrasound-guided sclerotherapy. These techniques are done in office under local anesthesia. 6. Endoscopic vein surgery. With endoscopic vein surgery, a small video camera is used to see inside the veins. This procedure uses a tiny camera at the end of a thin tube to move through the varicose veins. A surgical instrument at the end of the camera is used to close the veins. Then varicose veins are removed through small cuts. People who have this varicose vein surgery must have some kind of anesthesia, such as epidural, spinal, or general anesthesia. Only small incisions are required for this procedure. You will wear soft dressing on the leg for the 3 days following your surgery. Patients can return to normal activity within a few weeks. There are some common approaches includes are exercise, watch your weight and your diet, watch what you wear, evaluate your legs, avoid long period of sitting and standing, don't sit on your legs crossed. It's important to differentiate between the types of varicose veins because the treatment for varicose veins is different for each. Cost is depending on what treatment is used. Medical insurance also covered in this treatment. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.